Opioid addiction doesn't just happen in a vacuum. Its destructive fingers reach far beyond the person misusing. The ripple effect sends shockwaves and pain through entire families. 11 News reporter Lacey Griffith introduces us to one Maryland mom who used her experience to help educate others.
Raising 4 kids in Western Maryland, Karen Miller never thought it would happen to her family.
We never saw this coming.
Karen's husband, Greg, is a construction worker. He got hurt in a car accident in 2000 and not long after suffered an injury on the job. That's when his addiction to pills began.
The disease progressed. He got his own prescription from the doctor. That became not enough pills.
That's when their money started to disappear.
Every day I'd go into the bank account and there would be $60 gone. And so he was buying that much extra every day.
She, like many others, didn't know how powerful the drugs are.
I thought it was a little bit stronger than an aspirin.
For their son Lucas, his addiction started around 2009 in a totally different way.
Roommate that he lived with was dealing pills, and I didn't know this.
Lucas started to morph into a different person.
I noticed a lot of sniffling, and I asked him, did he have allergies? Here again, I'm clueless.
His older sister, Lindsay, started to see signs Lucas was misusing drugs even before their mom.
He started hiding his hands. I started noticing needle marks. His attitude changed, his work ethic. He wrecked a number of vehicles in the family. It just kind of became obvious.
Both Karen and Lindsay tried to intervene.
He'd come to me crying, saying, Mommy, how did I get like this? I don't want to be like this anymore. And he really didn't. My husband doesn't want to be like this. They're victims of this pandemic that we face daily.
Lucas spiraled out of control.
He pushed me away, told me to leave him alone. He was really sick, really sweaty, clammy, wouldn't get help.
And you're screaming and crying in your bed, wondering where they are. And hoping you don't get that phone call.
Karen went down every avenue to help Lucas. Karen even sent Lucas to Mexico for an Ibogaine treatment, which is illegal in the U.S. According to the FDA, Ibogaine has a high potential for abuse, is not accepted as a medical treatment in the States, and it's not safe even under medical supervision. But she says it helped.
Within 2 months of that time, he found sobriety, which was the day before Thanksgiving.
That was in 2014. Lucas's life has changed. He moved to Colorado, has a job, has a car, and his family says he's himself again.
But I mean, he's so happy. He's doing so much better. And just to be able to see him smile, it's awesome.
I wish I had educated myself back then, which is what I encourage other families to do.
Karen decided to take action. Around 2012, she created Save Our Children, a family peer support group, and then Maryland Heroin Awareness Advocates.
I connected with other families that were going through this who were not embarrassed and ashamed to talk about it.
Now that Lucas is in a good place, Karen is hopeful Greg can get there too.
But because he almost died in 2011 from withdrawal, he's scared. And then when he felt the withdrawal from the Suboxone, it brought back those traumatic memories from the Percocet withdrawal.
She says the goal is to get Greg into a treatment center.
I'm proud of my dad. My dad's a hard worker. He's an awesome person. And, although it's frustrating, my mom's been by his side the whole time.
It's a lifetime battle, and they will struggle forever with this opioid addiction. If you see a sign, consider that the possibility that there's a problem within your family.
Karen feels blessed her 28-year-old son and husband of 33 years are still here on Earth because for many others struggling with addiction, they're not as lucky. Reporting in Western Maryland, Lacey Griffith, WBAL TV 11 News.
Joining me now, a panel of experts in the fight against heroin and opioid addiction. Let me introduce substance abuse consultant Mike Gimbel, Also, City Health Commissioner Dr. Lena Wynn and Harford County Sheriff Jeffrey Gaylor. Thank you all for coming by. Good to see you again.
Thank you.
Let's talk first about the beginnings of all this. There was a time when opioids, prescription drugs, had promise. Talk about the promise that doctors saw when it came to relieving pain.
There is a legitimate use of prescription opioids. If somebody has terrible pain from cancer, if they were in an accident and broke their leg, I mean, there is a use for painkillers, and opioids, prescription opioids like morphine and oxycodone, OxyContin have a use. The problem is that as a result of very aggressive and inaccurate marketing by drug companies, we have this epidemic of overprescribing of these opioids. The CDC estimates that in 1 year, there are over 230 million prescriptions for opioids that are written, which is enough for every adult American to have our own bottle. Wow. Now, that's a big problem, and it's a big contributor to why we have this opioid epidemic here in this country.
Mike, we got to a point, you were talking about the perfect storm. We drifted away from the medicine cabinet and out of the urban areas and suburban areas started to see it blossom as well. And that's as things took off?
Well, you know, what happened was heroin became kind of chic, very cool in Hollywood. Several celebrities died from heroin. The marketing of heroin grew, where the purity got to be so pure, just pure heroin, that it started hitting the suburbs, became kind of a middle-class drug all of a sudden, which we never saw before. Then all of a sudden it became kind of a war between gangs and Colombians and the Black Guerrilla family. All the drug dealers in the region began wanting to up their market. And that's when we saw fentanyl hit the market. So we have a high pure heroin plus the fentanyl, which makes it deadly. And all of a sudden it became chic and cool. Also, they realized they didn't have to inject it. They could smoke it or they could snort it, which made it very acceptable into the middle class communities. Oh, I'm not a junkie, I'm not shooting up heroin, but they're snorting it. We started seeing it at parties, at high school parties, college parties. So it became kind of cool, and they had no idea what this drug does to you.
And you bring up fentanyl, and it's interesting because those numbers are really staggering. I mean, you've dealt with dozens of cases in your county in a very short amount of time.
We have, and we're seeing a great increase this year, unfortunately, in our fatalities, up about 165% compared to where we were last year at this time. We've lost 23 lives already in Harford County this year. And the first 9 that have come back autopsy have been fentanyl, not heroin, and it's progressing. Fentanyl's available out there on the street, is plentiful and is cheap as the heroin that we're seeing.
What's the hardest part of your job right now, trying to contain this, both on the source end but also the user end?
Well, certainly, you know, we're targeting the dealers who would sell fentanyl and heroin. Often the buyers don't know what they're buying. They're going out to buy heroin, they're getting sold fentanyl. We're targeting the dealers in Harford County. And the hardest part is, honestly, we're trying to steer the victims, if they survive, to treatment. And we just dealt with one the other day that unfortunately we had done a lot of outreach to. His 5th overdose was his last. He had 4 prior overdoses, and his 5th one was his last. So we know these people are on a path to losing their life if we cannot get them into some sort of treatment. And that's got to be the hardest part. And it's really a non-traditional law enforcement role, but it's something we're working with our county partners on and trying to push those people and not charge those people for the overdoses, of course, in accordance with the Good Samaritan Act, but push those people toward treatment. As
we talk about dealing with overdoses, I have a feeling there's a difference of opinion when it comes to Narcan. Where do we all stand with that?
Well, I don't think there's a difference of opinion. I think where we look at it, my concern has always been that Narcan is an amazing drug.
Sure.
But without doing something, once you bring the person back from death, if you don't have treatment to send them to, the majority will use over and over and over again. So it's kind of like fighting with one arm tied behind your back. Narcan's an amazing drug. It's a miracle drug. We know that. But without having the treatment, immediate treatment, I don't mean just going to an ER, I'm talking about long-term treatment, then we're losing the battle. Because again, the majority of these addicts, because this is what addicts do, they keep using. You save their life, they go, wow, this is terrific, I can keep using, let's go again. Unless we get them and change. See, Narcan doesn't change their behavior, but it saves their life. And so my concern has always been that we need to beef up the amount of treatment so that police officers and health people, when they bring someone back, a paramedic, they can get them immediately. Because with an addict, you've got to get them into treatment quickly.
Dr. Nguyen, what do you think? The marriage of those two, the Narcan and the treatment hand in hand?
It's important for us to have both, but I do think that we have a difference of opinion. And the difference is that if we don't save a life today, there is no chance tomorrow for a better tomorrow. There's no chance for someone to get into treatment tomorrow. As a physician, I took an oath, and my oath is to save lives first and foremost. It's my professional responsibility and my personal moral duty. If I see someone in front of me and I know that I can give this medication, one squirt in the nose will save that person's life, I have to do that. In Baltimore City, we've gotten this to so many residents that everyday people have used Narcan over 800 times to save lives. Everyday people, not police or paramedics, but neighbors have saved the lives of 800 of their fellow neighbors.
Still ahead on State of Addiction.
I was an addict. I'm an addict. I was a heroin addict. The one thing we want is more drugs, more drugs. That's all we care about.
What our panel of experts thinks is most important when trying to get a handle on the opioid crisis. Plus,
we were the first in the country to take some of the steps we did. It wasn't enough. Now we're the first in the country to declare the state of emergency. It's still not enough.
Maryland leading the charge against opioid misuse. We sit down with Governor Hogan to talk about why he declared a state of emergency on the drug problem. Do you or someone you know need help with addiction? Call our hotline. We have volunteers ready to take your call. That number is 410-261-2300.